Accidents will always happen despite any measure of preventative procedure and care. It is very important for us to get immediate treatment for every injury, regardless how small we may think it is. Immediate examination and treatment is necessary for every injury. Countless emergency situations could emerge anytime, but to name a few: primary survey, choking, burn, CPR, heart attack, etc. These situations could lead to pretty serious circumstances if not given attention immediately. In this vlog, we will tackle about the proper procedures and application of first aid. First aid is emergency care given immediately to an injured person. The purpose of first aid is to minimize injury and future disability. In serious cases, first aid may be necessary to keep the victim alive. The primary survey is a quick way to find out how to treat any life-threatening conditions a casualty may have in order of priority. We can use DRABC to do this. It stands for danger, response, airway, breathing, and circulation. In doing primary survey, always remember to use DRABC: danger, response, airway, breathing, and circulation. First, we have danger. Before approaching the casualty, always make sure the area is safe. Second, we have response. Check if the casualty is responsive or unresponsive. As you approach them, introduce yourself and ask them questions to see if you can get a response. Kneel next to their chest and gently shake their shoulders, asking, "What has happened? Open your eyes." Third, we have airway. Next, you need to check that the airway is open and clear. Open the airway by placing one hand on the forehead to tilt the head back, and use 2 fingers from the other hand to lift the chin. Fourth, we have breathing. You now need to check if the casualty is breathing normally. Place your ear above their mouth, looking down their body. Listen for sounds for breathing and see if you can feel their breath on your cheek. Watch to see if the chest moves. Do this for 10 seconds. Lastly, we have circulation. Once you have established they are breathing, look and check for any signs of severe bleeding. Choking occurs when a foreign object lodges in the throat or windpipe, blocking the flow of air, because choking cuts off oxygen to the brain. Give first aid as quickly as possible. It is recommended to conduct a 5 and 5 approach to delivering first aid. Give 5 back blows. Stand to the side and just behind a choking person. Place one arm across the person's chest for support. Bend the person over at the waist so that the upper body is parallel with the ground. Deliver 5 separate back blows between the person's shoulder blades with the heel of your hand. Give 5 abdominal thrusts. Perform 5 abdominal thrusts, also known as the Heimlich maneuver. Stand behind the person. Place one foot slightly in front of the other for balance. Wrap your arms around the waist. Tip the person forward slightly. Make a fist with one hand. Position it slightly above the person's navel. Grasp the fist with the other hand. Press hard into the abdomen with a quick upward thrust, as if trying to lift the person up. Alternate between 5 blows and 5 thrusts until the blockage is dislodged. Burns are one of the most common injuries experienced by anyone. The term burn means more than the burning sensation associated with this injury. Burns are characterized by severe skin damage that causes the affected skin cells to die. For thermal, chemical, or contact burns, the first step is to run cold water over the burn for a minimum of 30 minutes. If the burn is small enough, keep it completely underwater. Flushing the burn takes priority over calling for help. Flush the burn first. If the victim's clothing is stuck to the burn, don't try to remove it. Remove clothing that is not stuck to the burn by cutting or tearing it. Cover the burn with a clean cotton material. If you do not have clean cotton material, do not cover the burn with anything. Do not scrub the burn and do not apply any soap, ointment, or home remedies. Also, don't offer the burned victim anything to drink or eat, but keep the victim covered with a blanket to maintain a normal body temperature until medical help arrives. Your priority is to check for any airway obstruction and to check breathing and circulation. Things not to do. Don't contaminate the burn with potential germs by breathing or coughing on it. Don't apply any medical or home remedy, including ointment, ice, spray, or cream. Don't give the burned person anything to ingest. If faced with a burn injury, decisive action is important for the best possible outlook. CPR or cardiopulmonary resuscitation is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest.
1, 2, 3, 4.
There are two commonly known versions of CPR. A. We have conventional CPR using chest compressions and mouth-to-mouth. B. We have compression-only CPR or hands-only CPR. Hands-only CPR is CPR without mouth-to-mouth breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
There are 5 critical components. 1. Minimize interruptions in chest compressions. 2. Provide compressions of adequate rate and depth. 3. Avoid leaning on the victim between compressions. 4. Ensure proper hand placement. 5. Avoid excessive ventilation. A heart attack occurs when the blood flow that carries oxygen to the heart is blocked. The heart muscle becomes starved for oxygen and begins to die. What to do? First, call for emergency help straight away and tell them you think someone is having a heart attack. 2. Help move the casualty in a comfortable position. The best position is on the floor, with their knees bent and their head and shoulders supported. You can place cushions behind them or under their knees. 3. Give them 1 aspirin tablet, 300 milligrams, and ask them to chew it slowly. Do not give aspirin to the casualty if they are under 16 or if they are allergic to it. 4. Ask the casualty to take their own medication if they have some. 5. Keep monitoring the casualty's level of response until emergency help arrives. If they become unresponsive at any point, prepare to start CPR. Without proper first aid, a simple injury could become severe, and in some cases, fatalities can occur as a result of lack of immediate medical treatment. First aid does not just promote faster recovery, but it helps save lives.